eGFR CKD EPI equation and its impact on kidney health. The estimated glomerular filtration rate eGFR is a key indicator of kidney function and plays a vital role in the diagnosis, monitoring, and management of kidney-related diseases. Essentially, the eGFR reflects how quickly the kidneys filter the blood, providing a non-invasive way to assess how well these vital organs are performing at their primary task of removing waste products and excess fluid from the blood. The eGFR is calculated using a mathematical formula that takes into account various factors such as age, sex, and serum creatinine levels, which are waste products from the blood that the kidneys would normally filter out. The CKD EPI chronic kidney disease epidemiology collaboration equation is one of the most widely used and accepted formulas for calculating eGFR. The importance of this metric lies in its ability to provide a standardized, reliable assessment of kidney function for a variety of populations, making it indispensable in both clinical and research settings. An important aspect of the eGFR is its ability to identify potential kidney problems long before symptoms develop. The kidneys are extremely adaptable and can continue to function normally even when severely damaged. Therefore, early detection of decreased kidney function through eGFR can allow for timely interventions that can slow or even stop the progression of kidney disease. This preventative power highlights the importance of regular kidney function testing, especially for people who are at higher risk for kidney disease due to factors such as diabetes, high blood pressure, or a family history of kidney disease. When discussing eGFR, values greater than 60 ml per minute, 1.73 square meters are generally considered the threshold for normal or mildly decreased kidney function. Specifically, values over 60 indicate that the kidneys are functioning well and are able to filter blood at a rate that meets the body's demands. Here's what the different eGFR ranges mean. eGFR greater than 90 ml per minute, 1.73 square meters. This is generally considered to reflect normal kidney function, provided there are no other signs of kidney damage or disease. However, it's important to note that kidney function naturally decreases with age, and a person's normal values can vary based on a variety of factors. eGFR 60 to 89 ml per minute, 1.73 square meters. This range is generally interpreted as mildly decreased kidney function. For many people, especially older adults, an eGFR in this range is not necessarily cause for concern. However, if the decrease in eGFR is due to an underlying condition such as diabetes or high blood pressure, further testing and management may be necessary. When an eGFR is greater than 60, it is generally reassuring, but it is also important to consider this value in conjunction with other clinical findings. For example, if there is evidence of protein in the urine, proteinuria, or structural abnormalities in the kidneys, an eGFR greater than 60 may still require closer monitoring and possible intervention. The CKD EPI equation was developed to improve upon earlier methods of estimating GFR, such as the modification of diet in renal disease MDRD study equation. The CKD EPI equation tends to be more accurate, especially for individuals with relatively high levels of kidney function, which is one reason it is widely used today. The formula includes several variables. Serum creatinine. This is the most critical component because it directly reflects kidney function. Creatinine is a byproduct of muscle metabolism and its levels in the blood are relatively stable. However, serum creatinine alone is not a perfect indicator of kidney function because muscle mass varies greatly between individuals, which is why the eGFR equation is needed. Age and sex. These factors are included because kidney function generally declines with age, and because men and women have different average muscle mass, which can affect serum creatinine levels. By incorporating these variables, the CKD EPI equation provides a more personalized assessment of kidney function, improving its accuracy across different populations. The eGFR is more than just a number on a lab report. It is an important indicator of overall kidney health, which has important implications for patient prognosis and treatment planning. For patients with chronic kidney disease (CKD), long-term monitoring of eGFR is essential to assess disease progression. A decrease in eGFR may indicate worsening kidney function, prompting a change in treatment to help preserve kidney function for as long as possible. In addition, eGFR is used to stage CKD, and different stages can guide treatment. CKD Stage 1. eGFR is greater than or equal to 90 ml per minute, 1.73 square meters with other signs of kidney damage. CKD Stage 2. eGFR 60 to 89 ml per minute, 1.73 square meters with kidney damage. CKD Stage 3. eGFR 30 to 59 ml per minute, 1.73 square meters. CKD Stage 4. eGFR 15 to 29 ml per minute, 1.73 square meters. CKD Stage 5. eGFR less than 15 ml per minute, 1.73 square meters, often indicating kidney failure. Each stage requires a different level of care and intervention, with the goal of slowing progression and managing complications. Limitations of using eGFR. While eGFR is a powerful tool for assessing kidney function, it is not without limitations. One of the main limitations is that it relies on serum creatinine, which can be affected by factors other than kidney function. For example, people with higher muscle mass may have higher serum creatinine levels, which may lead to an underestimation of their eGFR. Conversely, people with lower muscle mass, such as the elderly or those with chronic illness, may have lower serum creatinine levels, which may lead to an overestimation of their eGFR. In addition, the accuracy of eGFR is lower at very high or very low levels of kidney function. At very high levels eGFR greater than 90, the equation may not detect subtle declines in kidney function, especially in the early stages of CKD. Conversely, at very low levels eGFR less than 15, the equation may not accurately reflect the severity of kidney dysfunction. Despite these limitations, eGFR remains an important component of kidney function assessment. Clinicians must be aware of its limitations and take them into account when interpreting results, especially in patients at the extremes of muscle mass, age, or renal function.